I would start my assessment by gathering the appropriate equipment. For this assessment, I'm going to need a pin light and an otoscope. I would enter my patient's room, provide privacy, and do hand hygiene and introduce myself. Hi, my name is Chanel. I'm going to be your nurse today, and I'm going to perform an assessment of your head. This will include your eyes, your ears, your nose, your mouth, and your neck. If you have any questions throughout the procedure, just let me know, okay?
Okay.
And after he responds, I can tell that his hearing is intact and his speech is appropriate, along with his mood and affect. His clothes are appropriate for the season. He has good posture. His nutritional status appears adequate. His skin is of normal color. It's warm, pink, and dry. And then I will perform the assessment on his head, and I'll first note eye contact. He's making good eye contact with me when I communicate with him. His level of consciousness is intact ×4, and he's oriented. I'll note facial symmetry, and then I will assess and inspect his hair. There doesn't look like there's any issues with his hair. It's evenly distributed and no abnormalities. And then I will palpate. I'm checking for lumps or depressions. And I don't feel anything. And I will palpate his temporal artery and feel his pulse. And then I will move down to his temporal mandibular joint, and I will have him open and close his mouth. Note any pain or tenderness. And then I will palpate his frontal, which is right above his eyebrows, and maxillary sinuses, noting any swelling or tenderness. And that all appears good. And then I will assess his eyes. I will first note his sclera, which appear white, and they don't have any abnormal discolorations. I'll pull down his bottom eyelid to assess his conjunctiva. It should be a pale pink color and moist, which his is, and he has no issues with his cornea. His iris appears to be a normal shape and even color. His pupils are appropriate size. And then I will do the corneal light reflex, and this is to assess a symmetrical gaze. And how I'll do this is I'll use a pen light. I'll have the patient focus on an object behind me, and I will shine the light in the middle of his nose. And when I shine the light, I should see a pinpoint amount of light in the exact same spot in both eyes. Look beyond me. And when I shined the light, there was a pinpoint spot in his pupil, on the lower part of his pupil, so that indicates that he does have a symmetrical gaze. And then I'll do the confrontation test, and this is to test the patient's peripheral vision. I'll have the patient cover one eye. I'll cover the opposite eye, and I'll wiggle a finger out to the side, and when the patient can see the finger, he'll let me know.
Okay.
And I'll do it from another direction.
Okay. Okay.
And then we'll switch eyes.
Okay. Okay. Okay.
And this notes that the patient's peripheral vision is intact. And then we'll do the cover test, and this is to test eye symmetry. So I'll have the patient focus on a fixed object about 10 feet behind me, and I will cover one eye, and I will note movement in the opposite eye that is not covered. And the patient does not have any movement in the opposite eye. And the same with that eye, there is no movement in the opposite eye, so that indicates the patient has symmetrical eyes. And then I will do the cardinal field test. This is a test that examines the patient's ocular movements. When I do this test, I'm going to do an H shape. So I will start midline, and the patient will follow my pen light, and I will move laterally to the right, up, down, back to midline, over laterally, up, down, and back to midline. And then also I would do a Snellen test, and this is a test that measures the patient's visual acuity. So I would have a chart with letters on it, and I would have the patient stand 20 feet away from the chart, and the letters are arranged from largest to smallest, and I would have the patient read until the letters were too small for him to read. And I would note for any squinting or leaning forward or any misreading of the words. And again, that would test the patient's visual acuity. And then I'm going to assess the patient's mouth. No, I'm going to assess the patient's ears. And I will start by the external ear. I will note that he has no lesions or abnormal drainage. I will look at the pinna and the auricle, and I will look at both sides. And again, there's no drainage or anything, and so I will use my otoscope, and on an adult, you pull the pinna up and back, and I will insert, and I am noting the patient's ear canal and tympanic membrane. And his ear canal looks good, it's not red or inflamed or anything, and his tympanic membrane is a pearly color, which is good. If it was red, pink, or bulging, we would assume that would be an infection, and we would follow up further. And I'll do the same on the other side. Again, pulling the pinna up and back. Assessing the ear canal and the tympanic membrane, and this one is also pearly white, which is good. And then I'll move on to doing a whisper test. This is a test to measure if the patient's hearing is intact. Okay, back up a little bit. And what I'll do is I will have the patient occlude one ear, and I'll whisper a word, and the patient has to tell me what word I just whispered.
Apple.
Okay, and then I'll have the patient occlude the opposite ear and
Football.
And the patient was able to tell me what words I whispered, so that means that his hearing is intact, and that is good. And then I will assess the patient's nose. First, I will assess for any obvious issues. It appears symmetrical. There's no drainage coming from it. I will note patency of both nostrils by plugging one nostril and having the patient breathe through the other nostril. And doing the same. And both of his nostrils are patent, so that's good. I'll use my scope to insert. I'm visualizing his septum. There's no inflammation. The mucus looks good. And the same on that side. So no inflammation, and the mucus is a good color, so that's good. And then I will assess the patient's mouth. I'll have him open his mouth. I'm looking at his teeth for any cavities, the roof of his mouth, the hard and soft palate. There's no lesions. The mucous membranes look good. They're a pink color and they're moist. I'll assess his uvula, which is midline, and that's good. His tongue looks good. And then I will rate his tonsils, and his tonsils are not swollen, so they would be a 1+. I'll have him stick out his tongue and say ah. And his tonsils look good. And his mouth, there's no lesions, it's a good color, and it looks good. And then I'll move on to his neck. start by noting symmetry. It looks good. I will palpate his lymph nodes. I will start with preauricle, which is right in front of the ears, posterior auricle, which is behind the ears, submental, which is right underneath the chin, and then submandibular, which is below the jawline. And then I will assess the cervical lymph nodes, which are along the neck. And then lastly, I will assess the deep cervical chain. And these ones are deep, so you have to have your patient turn towards the side that you are palpating in order to feel them if they are swollen. So okay, and the other side. I will assess the patient's range of motion. I will have him put his chin to his chest and then side to side. And then I will assess his muscle strength by having him push against my hands. Okay, and then I will assess his trachea, noting that it's midline. And to do this, I'm going to do the posterior approach. So I'm going to get behind him. And to do this, it helps for you to feel it if you have your patient sit very straight, lean his head slightly forward and to the right. And I can feel his trachea is midline. And if you can't feel it, you can have him swallow. And you should feel it moving under your fingers, and it is midline, and everything appears good. And that concludes my head assessment. Thank you.